Now we go to the 5 transporting points. Jingwell points, LU11. To locate LU11 on the thumb, point 1 tune from the radial corner of the nail. How to find? The point is located at the junction of 2 tangents running along the proximal and radial border of the thumbnail, approximately 0.1 tune from the actual border of the nail. Needling 0.1 to 0.2 tune vertically or obliquely in a proximal direction or prick to bleed. Avoid needling the peroneus. For the action and indication, LU11 frees the senses, regulates the lung chi, clears heat, especially from the throat, opens the channel. Special features, LU11 is a Jingwell point, wood point, Sansi meow, ghost point, important distal point for sore throat caused by wind heat. This point expels exterior wind and especially wind heat and is often used for sore throat and swollen tonsils from attack of wind heat. In this case, it is bleed. It is usually used only for actual sore throat from exterior wind heat. It is also effective for interior wind and is used in conjunction with other well points of the hand in apoplexy and loss of consciousness from wind stroke to open the orifices and promote resuscitation. It is useful to compare the function of 5 major points of the lung channel. Lung 5 clears lung heat, resolves phlegm. Lung 7 releases the exterior, circulates defensive chi, stimulates the diffusing and descending of lung chi. Lung 9 tonifies the lungs. Lung 10 clears lung heat, benefits the throat. Lung 11 expels wind heat, stimulates the diffusing and descending of lung chi, benefits the throat. Lung 11 is the Jingwell point of the lung channel and in common with many of the Jingwell points is an important point to revive collapse, being indicated for loss of consciousness from wind stroke and cold or hot inversion. The internal pathway of the lung channel ascends as its highest point to the throat. As the terminal point of the lung channel, lung 11 has a particularly strong action on the opposite end of the channel and may be needled or pricked to bleed in all acute disorder of the throat and surrounding tissues due to excess heat and fire poison, as well as simple sore throat due to attack by exterior wind heat. Lung 11 is indicated for mumps and childhood throat moat, a traditional disease category more or less corresponding to tonsillitis. To induce bleeding more easily from lung 11, the thumb and index fingers of one hand are used to grasp and invigorate the patient's thumb, while using the other hand to prick the point. According to Master Shudan Shi of the Jin 1 dynasty, recuperation instantly follows bleeding. Both lung 11 and lung 10 have an important effect on the throat in comparison with lung 10, which is indicated for both excess and deficiency heat. Lung 11 is generally used for more extreme conditions due only to excess. The classic of difficulty states that Jingwell points treat fullness below the heart. The region below the heart specifically refers to the apex of the epigastrium, but many of the Jingwell points in fact treat stagnation and fullness throughout the chest region. Lung 11 is indicated for fullness of the heart and of the region below the heart, accompanied by sweating. Its ability to treat stasis and heat in the heart is further reflected by its indication for mania and agitation of the heart. For this reason, it has included under its alternative name of Guishin, ghost fate, among San Simao's 13 ghost points for the treatment of mania disorder and epilepsy. Thank you for your attention.
Let's talk about spleen 3, supreme white, a source yuan point. Location on the medial aspect of the foot, in the depression proximal to the head of the first metatarsal bone at the border of the red and white skin. When palpating along the border of the red and white skin on the medial aspect of the foot from distal, that means the toes, to proximal, the ankle, the metatarsophalangeal joint forms a prominent landmark. Spleen 3 is located just proximal to this joint in a clearly palpable depression, which marks the junction of the head and the shaft of the first metatarsal bone. Located in a comparable position is bladder 65, which is proximal to the head of the fifth metatarsal bone on the lateral border of the foot. In comparable locations on the borders of the hand are LI3 on the radial aspect and SI3 on the ulnar aspect of the hand. Needling of spleen 3, 0.5 to 1 soon vertically or obliquely from medial towards lateral. Caution, needling this point tends to be painful. Actions, indications. Spleen 3 tonifies the spleen, harmonizes the lower burner, eliminates dampness and damp heat, regulates qi locally. Special features, yuan source point, shoestring point, earth point, pen point, according to the 5 phases. Important point for tonifying the spleen. Spleen 3 is a major point to tonify the spleen, as it is the source point of the channel and also earth point of an earth channel, as spleen belongs to earth, which is at the center of the 5 elements. The source point of the spleen is the center of the center. It is very frequently used to tonify the spleen in any of its deficiency patterns. Spleen 3 stimulates the mental faculties pertaining to the intellect, the E, which are associated with the spleen, and it can be used in cases when spleen qi has been weakened by excessive mental work. The use of spleen 3 can then stimulate the brain, promote memory, and induce mental clarity. This point is useful to stimulate mental powers in patients suffering from post-viral chronic fatigue syndrome. Another important function of spleen 3 is to resolve dampness, for which it is a major point. It is used in any dampness pattern in the upper, middle, or lower burner. When used to resolve dampness, it should be needled with reducing method. Examples of symptoms and signs of dampness are confused thinking, feeling of heaviness and mozziness, or fuzziness of the head, feeling of fullness of the epigastrium, no appetite, feeling of heaviness of the body, and sticky tongue coating. Spleen 3 is particularly useful to resolve dampness from the head, where it causes a feeling of heaviness and mozziness of the head and a dull frontal headache. Spleen 3 is also frequently used in chronic retention of phlegm in the lungs. Phlegm is retained in the lungs, but it originates from the spleen due to impairment of its function of transportation and transformation. Reinforcing spleen 3 can at the same time tonify the spleen to strengthen the lungs, strengthening the earth to nourish metal and resolve phlegm. A more unusual use of spleen 3 is to strengthen the spine. According to chapter 4 of the Simple Questions, the spleen controls the spine. Spleen 3 is a very useful point to strengthen and straighten the spine in cases of chronic backache. Summary of functions. Spleen 3 is a major point to tonify spleen, stimulates the intellect and mental faculties, regulates the intestines, as in abdominal distension and pain, diarrhea, resolves dampness, particularly from the head, resolves phlegm and strengthens the lungs, strengthens the spinal muscles. Thank you for listening.
Let's continue our discussion on the connecting or LU points. Specifically, we discussed today on stomach 40 or the abundant bulge point. Stomach 40 is located at the midpoint of the line joining stomach 35 and stomach 41 and 2 finger breadths lateral to the anterior crest of the tibia, or 1 finger breadth lateral to stomach 38 between the extensor digitorum longus and the peroneus brevis muscles. How to find stomach 40? Here we have a quick method, the spreading hands technique. Place the little fingers on stomach 35 or the lateral eye of the knee, level with the knee joint space, and stomach 41 in the depression between the tendons of the extensor digitorum longus and the hallucis longus, level with the highest prominence of the lateral malleolus, and determine the midpoint of this line using the thumb. Stomach 40 is located in a depression 2 finger breadths, 2 middle finger breadths, measured from the anterior crest of the tibia, lateral to this point. Or stomach 40 may be palpated dynamically according to pressure sensitivity. Located on the same level, which is H proximal to the highest prominence of the lateral malleolus, are stomach 38, which is 1 finger breadth lateral to the tibia, and bladder 57, which is on the dorsal aspect of the lower leg, halfway between bladder 40 and bladder 60. Stomach 40 is needled vertically or obliquely, 1 to 1.5 tune. For its action and indications, stomach 40 transforms dampness and phlegm, clears phlegm in the lungs and heart, and calms the shen. For its special features, stomach 40 is the LU connecting point. It is the main acupuncture point for eliminating phlegm. Stomach 40 is a very important point since it is the point to resolve phlegm in all its manifestations and in all parts of the body. It eliminates substantial phlegm, such as profuse expectoration from the chest, phlegm in the form of lumps, such as lumps under the skin, thyroid lumps, and uterus lumps, and non-substantial phlegm, such as the one that clouds the mind and obstructs the mind's orifices, causing mental disturbances or simply headache, dizziness, muzziness of the head. In all these cases, this point should be needled with reducing method to resolve phlegm. Owing to its phlegm eliminating action, it is very much used in the treatment of asthma, as it is also has the effect of opening the chest and soothing breathing. Another action of this point is to calm the mind, on which it has a profound effect. It can be used in all cases of anxiety, fears, and phobias, not only if they are caused by misting of the mind by phlegm, but also if they're caused by rebellious chi. The phlegm resolving of this point should not be overemphasized, overlooking its other functions. Apart from its use in resolving phlegm, stomach 40 can also be used to subdue rebellious chi of the stomach and lungs when the person is very anxious, and anxiety reflects on the stomach function, which such symptoms as tightness of the epigastrium, a feeling of knot in the stomach, or some people say a feeling of butterflies in the stomach. Finally, this point also has an action on the chest, and it is used to open and relax the chest when it is painful or there is a feeling of oppression. It may be used after bruising of the chest and rib cage. In these cases, it may be used in combination with pericardium 6, normally unilaterally in crossed over. So here is an illustration of the actions of stomach 40. Its action on the stomach, the chest, and the head. So, stomach 40 has many other functions. Stomach 40 subdues rebellious stomach chi, all full conditions of the stomach. It's also indicated to it opens the chest with lung 7 or pericardium 6. It also calms the mind and regulates the heart. In summary of its functions, stomach 40 is a major point to resolve phlegm in all its manifestation and in all parts of the body. Example, substantial phlegm, such as profuse expectoration from the chest, phlegm in the form of lumps, like in lipomas, goiter, and fibroids, in non-substantial phlegm, such as the one that clouds the mind and obstructs the mind's orifices, causing mental disturbances or simply headache, dizziness, and muscleness of the head. It is also used for asthma as it opens the chest and subdues rebellious chi. It calms the mind for anxiety, fears, and phobias. It also subdues rebellious chi of the stomach and lungs when the person is very anxious, and the anxiety reflects on the stomach function with such symptoms as tightness of the epigastrium and a feeling of knot in the stomach. Finally, stomach 40 opens the chest. Thank you for your attention.
Now we continue with the back transporting points, bladder 20, spleen shoe. Bladder 20's location is 1.5 tune lateral to the posterior midline on the level of the lower border of the spinous process of the 11th thoracic vertebra, T11. How to find? In a seated position with the arms hanging down, the spinous process of T7 is approximately on the level of the inferior angle of the scapula. From there, count down 4 spinous processes to the spinous process of T11. Bladder 20 is located on the level of the lower border of its spinous process and at the highest point of the paraspinal musculature. Or locate the articulation of the most inferior rib, which is the T12, and palpate in a superior direction to T11, or use the lumbar spine for reference. Located on the same level are DU6 on the midline, a point of EXB2, 0.5 tune lateral to the midline, bladder 49, 3 tune lateral to the midline. Needling 0.5 to 1 tune obliquely towards the spine. In clinical practice, this point is often needled transversely, subcutaneously towards the spine. This allows the patient to lie in a supine position during needle retention. The needles can be secured with tape. Caution is pneumothorax. For the action and indication, bladder 20 tonifies the spleen, qi, and yang, regulates qi in the middle, and raises qi. Transforms dampness, holds, and nourishes the blood. Special features, bladder 20 is the back shoe point of the spleen, major point for tonifying the middle, especially for spleen deficiency syndromes. Use moxibustion or tonifying needle techniques for nourishing the blood. Bladder 20 is a very important point among all the back transporting points. It is a major point to tonify the spleen and stomach and invigorate the spleen function for transformation and transportation. It is used in any spleen qi deficiency pattern with symptoms of tiredness, loose stool, no appetite, abdominal distension. Combined with bladder 21, it provides a powerful tonification of the root of the post-heaven qi, that is stomach and spleen, and is used to tonify qi and blood when a person is physically and mentally exhausted over a long period of time. By tonifying spleen qi, this point also resolves dampness and phlegm, which derive from dysfunction of the spleen activity of transformation and transportation of fluids. Bladder 20 is therefore used in practically every condition with chronic dampness or phlegm. By tonifying spleen chi, bladder 20 also nourishes blood as the spleen is the origin of blood. This point is therefore very much used to nourish blood, often in combination with bladder 23, the kidney bakshu. In this case, the point should be tonified or direct moxa applied. As it tonifies spleen chi, it strengthens two other aspects of spleen chi. It leaves spleen chi when this is sinking and causing a prolapse or simply a bearing down feeling in the lower abdomen. By tonifying spleen chi, it stops bleeding and caused by deficient spleen chi not holding the blood in the vessel. When it is used for excessive menstrual bleeding, it is combined with bladder 23. In conclusion, bladder 20 is a very important point to be reinforced in nearly all chronic diseases when the person is very depleted in energy. Summary of function, bladder 20 tonifies spleen and stomach for the poor appetite, tiredness, loose stool, weak limbs, abdominal distension. It resolves dampness, the feeling of fullness, feeling of heaviness, sticky taste, jaundice, feeling of heaviness of the limbs. It regulates the intestine, the abdominal distension and pain, borborygmi, diarrhea, undigested food in stools. It lifts the spleen chi and stops bleeding for the prolapse of stomach or uterus, bearing down feeling in the lower abdomen. It nourishes blood, very important tonifying point. Spleen chi deficiency may result from constitutional deficiency, irregular diet, excessive thinking or overwork, insufficient or excessive exercise, or prolonged illness. Deficiency of spleen chi and impairment of the transportation and transformation function will give rise to such symptoms as lassitude, lack of appetite, diarrhea with undigested food in the stools, and childhood nutritional impairment. And bladder 20 is an essential point in the treatment of such disorders. Bladder 20 is specifically indicated for the symptoms of remaining thin despite such much eating. The treatise on the spleen and stomach by Li-Dong-Wan offers an interesting discussion on the various possible relationships between appetite and obesity or leanness, saying that if the spleen and stomach are both excess, food intake is large and the person easily becomes fat. Secondly, if both are deficient, there is either inability to eat, a person is thin, or alternatively, a person easily becomes fat, yet weak. Despite a low food intake, this latter condition being due to accumulation of phlegm dampness. Okay. And thirdly, there are also cases of thinness despite large food intake. In this case, fire hidden in the chi base in the stomach result in a large food intake, while spleen vacuity leads to withered flesh. Okay, this is known as food liquor. Shui has said large food intake is not incompatible with weak muscles. The apparently contradictory condition of spleen deficiency with a large appetite is often encountered in clinical practice, and in explanation of hidden stomach fire with spleen chi deficiency explain this well. Thank you for your attention.
Let us talk about gallbladder 25, capital gate, a front collecting point, or a front move or alarm point. Gallbladder 25 is located on the lateral aspect of the rib cage at the lower border of the free end of the 12th rib. How to find? Place the hand on the upper abdomen and with gentle pressure, glide along the lower border of the rib cage until you can feel the free end of the 11th rib. So this is liver 13, slightly superior to the umbilicus. By continuing to palpate along the lower border of the rib cage, you will feel the free end of the 12th rib on the lateral aspect of the waist. Locate gallbladder 25 on its lower border. For orientation, when pressing the flexed elbow onto the thorax, the tip of the olecranon will rest on the area around the free end of the 11th rib. This is liver 13. Needling of GB25, vertically or obliquely 0.3 to 1 soon. With caution, peritoneum, the needle should be inserted into the obliquus externus or internus muscles. Actions, indications of gallbladder 25. Tonifies the kidneys and regulates the water passages. Strengthens the spleen, regulates the intestines. Benefits the lumbar region. Special feature, gallbladder 25 is the front midpoint of the kidney. Although this is the front collecting point for the kidney, it is used more for diagnosis than treatment of kidney problems. Summary of functions: regulates water passages of the lower burners. So this is very good for difficult urination, dark urine. Regulates the spleen and the intestine. So when you have barborrhigma, diarrhea, abdominal distension, and pain. Strengthens the lower back. So good for lower backache, inability to stand for long, pain in the lateral costal region and back, and hip pain. Gallbladder 25 is the front midpoint of the kidneys. The term mu means to gather or to collect, and the front midpoints are where the qi of the Zhang Fu gathers and concentrates on the anterior surface of the body. The main action of gallbladder 25 is to assist the mutual relationship between kidneys and spleen. According to the complete works of Qing Yue, Mingmen is the sea of essence and blood. The spleen is the sea of water and grain. Together, they are the root of the 5 Zhang and 6 Fu. The kidneys are the source of pre-heaven qi and rule the fluids, whilst the spleen is the source of post-heaven qi and rules the transportation and transformation of food and water. The kidney yang is the root of all the yang of the body, and its fire is the source for the vigor of the spleen's transportation and transformation function. At the same time, it is the spleen which extracts the essence from food to supplement the kidney essence. When this mutual support between the kidneys and spleen breaks down, there will be impairment of both spleen's digestive function and the kidney's function of ruling the fluids. Gallbladder 25 is indicated for cases of cold or damp diarrhea, borborygmus, and abdominal distension resulting from spleen yang deficiency, which either derives from kidney yang deficiency or due to its prolonged nature has injured the kidney yang. It is also used to tonify kidney yang to facilitate the flow of water in urinary diseases and is indicated for difficult urination, concentrated urine, swelling of the face, and failure of the water passages to flow. The kidneys rule the lumbar region and the bones. The other principal application of gallbladder 25 is in the treatment of disorders of the lumbar region and spine, particularly when due to kidney deficiency. It is therefore indicated for weakness of the spine and for lumbar pain with inability to stand for long. Due to its location on the gallbladder channel, it is also indicated for combined pain of the back and lateral costal region, for example, in renal colic, as well as for pain of the hip. Thank you very much for listening.
Let's now talk about pericardium 4, or the she cleft gate point, and accumulation, or she cleft point. Pericardium 4 is located 5 Shun proximal to the anterior space of the wrist joint, most distal wrist crease between the tendons of the palmaris longus and the flexor carpi radialis muscles. How to find pericardium 4? Using the spreading hands technique, place the little fingers in the center of the anterior wrist joint space and at the level of pericardium 7 and the cubital crease respectively at pericardium 3. From the midpoint of this distance, measure 1 tune in a distal direction. On this level, locate pericardium 4 between the two tendons, which become more pronounced when the fingertips are pressed together. If only one tendon is visible, this will be the tendon of the flexor carpi radialis muscle. Pericardium 4 is located on its ulnar aspect. Pericardium 4 is needled 0.5 to 1 tune vertically or 1 to 1.5 tune obliquely in a proximal direction. For its actions and indications, pericardium 4 tonifies the blood, dispels blood stasis. It calms the shen, cools the blood, and opens the channel. For its special features, it is the chic left point of the pericardium channel. It is a major point for acute, painful blood stasis in the region of the thorax and the heart. Pericardium 4 is an important point of the pericardium channel, and being the accumulation point, it is used in acute conditions, particularly to stop pain. It has an influence on the chest and stops chest pain. Being the accumulation point, it is the best point to use for painful and especially acute painful conditions of the channel. Pericardium 4 has a special action in calming the heart and regulating its rhythm, so it is the point of choice to use for arrhythmia and palpitations. It also invigorates blood and eliminates stasis, especially in the chest, so that it is a very important point to use for chest pain due to stasis or of heart blood. It also cools blood and can be used for skin diseases caused by blood heat. Finally, pericardium 4 strengthens the mind in cases of heart deficiency, which may give rise to fear, anxiety, insomnia, and depression. In summary of its functions, pericardium 4 invigorates blood and eliminates stasis, like in chest pain and heart pain. It cools blood and stops bleeding, as in the cases of coughing of blood, vomiting of blood, and nosebleed. It also calms the mind for agitation, anxiety, insomnia, mental restlessness, depression, and fright. And it also removes obstructions from the channel and stops pain. Pericardium 4 is the chic left point of the pericardium channel. The chic left points are where the chi and blood, which flows relatively superficially along the channels from the genial points, gather and plunge more deeply. The chic left points in general are indicated in the treatment of acute conditions and pain, which the chic left points of the yin channels have an additional action of treating disorders of blood. Pericardium 4 is an important point to treat both acute stasis of blood and heat in the blood. Through its dual actions of invigorating blood and moderating acute conditions, pericardium 4 is a primary point for treating stagnation of blood in the chest and heart, giving rise to acute pain which may radiate to the neck, back, or left arm, or be accompanied by vomiting. Its important role in the treatment of heart pain was both emphasized in the classics and is borne out by modern clinical practice and research. By virtue of its ability to clear heat from the blood and stop bleeding, pericardium 4 is indicated for hot, reckless bleeding in the upper jaw, giving rise to nosebleed and vomiting or coughing of blood. The second principal group of indications for pericardium 4 includes a variety of mental and emotional disorders, such as agitation of the heart, insomnia, melancholy, and fear in frightened people. The relationship between pericardium 4 and emotional disorders is expressed through its effect on the blood and the heart chi. The heart rules the blood and houses the spirit, and there is therefore a reciprocal relationship between blood and disturbance of the spirit. On the one hand, when blood is stagnant and does not flow freely, essential nourishment will not reach the heart, and the heart's function of housing the spirit may be disrupted. On the other hand, emotional disturbance may lead to stagnation of blood. The spiritual pivot states, internally, a person may be injured by worry and anger. When this occurs, the chi will rebel upwards. When the chi rebels, thus the 6 shoe points, as the points of the 6 channels, will not flow, the warm chi will not circulate, and internally the congealed blood will coagulate and not scatter. By resolving stasis of blood, pericardium 4 is able to both treat emotional disharmony and to resolve the heart-blood stasis that results from it. Blood stasis in the heart most commonly occurs as a result of deficiency of heart chi and yang. These patterns frequently give rise to feelings of fear, melancholy, and a diminished spirit, typically seen in patients after a myocardial infarct or cardiac surgery, the shock of which may further injure the heart chi. Pericardium 4 is able to regulate heart chi as well as the blood, and is classically indicated for insufficiency of the spirit chi. Finally, there may be symptoms of mental and emotional agitation, as well as hemorrhage, when the heart enters the nutritive or blood levels during febrile disease and rise to disturb the spirit. Thus, the treatise on epidemic warm febrile disease stated, when the nutritive system is invaded by heat, the blood is consumed, the spirit is disturbed, and there is insomnia. Pericardium 4 is able to calm the spirit in such cases by clearing heat from the nutritive and blood levels. Thank you for your attention.
Now we go to the 4 C's, the introduction. The 4 C's are discussed in chapter 33 of the spiritual axis. As often happens in acupuncture, the channel system is compared to an irrigation system. The channels are likened to rivers which flow into the 4 C's. The body has 4 C's and 12 river channels. These flow into the C's, of which there is an east, west, north, and south one. The 4 C's, C of chi, C of food, C of blood, C of marrow. The 4 C's are the C's of marrow, C's of blood, the C's of chi, and the C's of food. Each of these C's is activated by specific upper and lower points. Chapter 33 of the spiritual axis says the stomach is the C of food. Its upper point is stomach 30. And its lower point is stomach 36. The penetrating vessel, Xiongmai, is the C of the 12 channels. Its upper point is bladder 11. And its lower points are stomach 37 and stomach 39. The center of the chest is the C of Qi, and its upper point are Du 15 and Du 14, and it also has a point in the front, stomach 9. The brain is the C of marrow, its upper point is Du 20, and its lower point is Du 16. Although the text does not specifically say so, it is logical that Trend 17 is also a point of the C of Qi, as the text refers to the C of Qi being in the center of the chest. Points of the 4 C's. C of food, stomach 30, the upper, and stomach 36, the lower. C of blood, bladder 11, the upper, stomach 37, and stomach 39, the lower. C of chi, do 15, and do 14, the upper, and stomach 9, front, also run 17. C of marrow, do 20, the upper, and do 16, the lower. Each C can be adversely affected by deficiency or excess condition, as well as by conditions of rebellious chi. Chapter 33 of the spiritual axis says, when they C function harmoniously, there is life. When they function against the normal flow, there is disease. When the C of chi is in excess, there is a feeling of fullness in the chest, breathlessness, and red face. When the C of chi is deficient, there is shortness of breath and dislike to speak. When the C of blood is in excess, the person has the feeling of body getting bigger and the person is unable to pinpoint the trouble. When the C of blood is deficient, the person has the feeling of the body getting smaller and is unable to pinpoint the trouble. When the C of food is in excess, there is abdominal fullness. When the C of food is deficient, the person is hungry but has no desire to eat. When the C of marrow is full, the person feels agile, while light limbs and great physical strength. When the C of marrow is deficient, there is dizziness, tinnitus, blurred vision, weak legs, and desire to lie down. Symptoms of the 4 C's, C of chi. For the excess, there is fullness of the chest, red face, breathlessness, and for deficiency, there is shortness of breath, dislike of speaking. C of blood, for excess, there is feeling of body getting bigger. For deficiency, feeling of the body getting smaller. For the C of food, excess, there is abdominal fullness. Deficiency, hungry but no desire to eat. For the C of marrow, excess, there's light limbs, feeling of strength. Deficiency, dizziness, tinnitus, blurred vision, weak legs, desire to lie down. Although the main texts mention excess and deficiency of the 4 C's with the above symptoms, it also mentions the pathological condition of the rebellious chi. That is chi flowing upward instead of downward. This is particularly evident in the case of C of chi, as the symptoms of breathlessness, fullness of the chest, and red face are symptoms of lung chi rebelling upwards. The C of blood is synonymous with the penetrating vessel, the chongmai, as the text makes clear. This is a great relevance in clinical practice and especially in gynecological, as we treat the penetrating vessel for disharmonies of blood and especially blood stasis. The C of marrow is synonymous with the brain, as it is marrow that fills up the brain. Its symptoms of deficiency are clearly related to the obfuscation of the sense of orifices due to not being nourished by the marrow. As the kidney essence is the origin of marrow, those symptoms are also symptoms of kidney deficiency. Dizziness, tinnitus, blurred vision, weak legs. The C of marrow is related to the governing vessel, the dumai, which flows in the spine and into the brain. For this reason, the points of the C of marrow, the do20, do16, are on the governing vessels. The C of food is synonymous with the stomach, and both of its points are on the stomach channel. This is also of relevance in clinical practice, as we always need to treat the stomach in any disturbance of food absorption or digestion. The C of chi is clearly related to the lungs and the gathering chi, the song chi, and its deficiency symptoms, the dislikes of speaking, is a lung deficiency symptoms. Thank you for your attention.
Let's now continue with chronic fatigue syndrome, and we shall be discussing the patterns spleen and kidney yang deficiency and liver blood deficiency. For spleen and kidney yang deficiency, the clinical manifestations: tiredness that is worse in the mornings, slight ache in the muscles, muscle fatigue after slight exertion, slight epigastric and abdominal distension, loose stools, lower back ache, weak knees, frequent pale urination, dizziness, tinnitus, feeling cold and cold feet. Tongue is pale, pulse is weak and deep. Treatment principle: tonify spleen and kidney yang, resolve dampness. Points: REN 12, stomach 36, spleen 6, bladder 20, bladder 21, kidney 3, REN 4, kidney 7, bladder 23, DO 20, REN 9, and spleen 9. All are needled with reinforcing method except the last two, REN 9 and spleen 9, which should be needled with even method. Moxa is applicable. REN 12, stomach 36, spleen 6, bladder 20, and bladder 21. Tonify the spleen and stomach. Kidney 3, REN 4, kidney 7, and bladder 23. Tonify kidney yang. DO 20 tonifies and lifts chi and lifts mood. REN 9 and spleen 9 resolve dampness. Now let's talk about liver blood deficiency as a pattern for chronic fatigue syndrome. Clinical manifestations: tiredness, muscle fatigue on slight exertion, slight muscle ache, blurred vision, numbness of limbs, dizziness, and scanty periods. Tongue pale and thin, pulse choppy or fine. Treatment principle: nourish liver blood, strengthen the sinews, resolve dampness. Points: liver 8, stomach 36, spleen 6, REN 4, GB34, REN 9, spleen 9. All are needled with reinforcing method except REN 9 and spleen 9, which should be needled with even method. Liver 8, stomach 36, spleen 6, and REN 4 nourish the liver blood. GB34 strengthens the sinews. REN 9 and spleen 9 resolve dampness. Thank you very much for listening.